None of us like making mistakes. Mistakes are painful and oftentimes very costly. And the same is true when you go on Medicare. You don't want to make any mistakes. And in this video, I'm going to show you how to avoid the most common and costly mistakes that people make when going on Medicare. Now, the first costly mistake that people can make is by not getting in Medicare at the right time. In other words, they come into Medicare at the wrong time. They come in either too early or too late. And so we don't want that to happen to you. So let me explain the scenarios that people find themselves in as they're approaching Medicare eligibility. Number one, you're still working. And if that's your situation where you're still working, actively working, and covered by an employer-provided plan, it could be your plan or maybe your spouse is still working, either way. But if you have an employer-provided plan available to you and there are 20 employees at the company or more, then you're not required to do anything with Medicare. Now, I know you'll hear people say, well, if you're going to keep working, you still have to enroll in Medicare A, and if you don't, you'll be penalized. And that's absolutely not true. For the majority of people, Medicare A is a zero premium, and so there's no penalty attached to a zero premium whatsoever. So you don't have to worry about being penalized. If there's 20 or more in the group plan, and it's attractive insurance, meaning it's better than a Medicare option, you don't have to do anything with Medicare. And so the way to decide whether it's good to start Medicare at 65, even if you're working, is just simply make a comparison between the group plan and Medicare. So you want to know what's your premium, what's it cost you to be on the plan. That's issue number one. And my rule of thumb is if your premium is costing you $250 a month or more just for your coverage, then Medicare is probably going to make more sense. But if your premium is $100, $150 a month or so for you, then that's a very reasonable price. But the point is, you got to know your premium to make this decision. Number two, do you have a deductible? And do you ever meet the deductible? Is your deductible $3,000 or $5,000, $1,500? We'd like to know that. And do you ever have to meet that deductible? Number three, what's your co-insurance? Are you on an 80-20 plan, a 90-10 plan? And if you had a serious illness, what's the max out of pocket? What's the most you would spend? $5,000, $10,000? Because that's the risk that you carry on that plan if you did have an illness. And then fifthly, you're going to look at the medications. So your premium, your deductible, your co-insurance, max out of pocket, and your medications. And with that information, then you can make a very reasonable assessment whether you should be on the plan or not. So you're going to make that comparison between the group plan and Medicare. So if the group plan is better than a Medicare option, a reasonable price, the terms are very good, you like the insurance, then you don't have to do anything at all with Medicare. And to do so would be a mistake financially. Now, here's where sometimes people get themselves into problems, and that's this. Let's say that you're still working or your spouse still working and you're on Social Security. Well, when you're on Social Security, you're going to be automatically enrolled into Medicare at 65. They actually just mail you the card about 90 days to 100 days prior to your birth month. So if you're on Social Security, Medicare A and B card shows up, and if you're covered, again, by that group plan that has 20 or more, if the group plan's still attractive, then what you're going to do, even though that Medicare A and B card is going to come to you, what you're going to want to do is you're going to want to keep the Medicare A and you're going to want to drop the Medicare B, because the group's going to pay first anyways and Medicare B is going to pay second. So what's happening is you're paying a premium for that Part B, and this is where the true waste of money comes into play. Hey, we really appreciate you taking the time to watch these YouTube videos, and because of that, we have a free gift for you. And if you'll click right up here, you'll just have to give your name and email address, and we'll send that free gift right out to you. Right now, that Medicare B is $170.10 a month. In 2023, it's actually going to go down a little bit. It's going to $164.90 a month. So if you keep the card, you got to start paying for B. And if the group's 20 or more, the Medicare B is going to pay second. And frankly, they're not a real good secondary payer. So to me, that would simply be a waste of money every month to stay enrolled in B. So to get out of B, if you're automatically enrolled in Medicare, you have two options. You can mail the card back in, your Medicare card. When it comes, just turn it over and they give you the option. It'll say, I do not want medical insurance. Part A is called hospital, Part B is called medical. So you check the box, you sign your name and send the card back in. And when it gets to Medicare, they're going to drop off the Medicare B. You no longer have to pay for that, and they'll send you back a new card that'll say Part A, hospital only, and then you can pick up B at a later date. Okay, so that would be a waste of money to keep it if indeed the group plan is good. All right. Now, if you would like to disenroll, there's one other way, and that is to fill out what we call a Form 1763. It's an SSA Medicare Form 1763. And that's another way you fill the form out and just tell them on there that you would like to drop Part B because you have an employer-provided plan. Either way. But I prefer you mail the card back in. That way they'll send you back a new card that'll say A only. So that's those of you that are still working, 20 or more. You don't have to do anything with Medicare. Now, there are times when people are still working 20 or more, but the group plan is not very good. In other words, we make that comparison, the premium, the deductible, the co-insurance, and the max out-of-pocket and the medications. We look all that, and we realize this is not a very good plan. Well, what I'd recommend doing then is just dropping the group plan totally. They have to let you do that at 65, so it's fine to do that, and then you can just go on Medicare. And so you would enroll into Medicare A and B, and then you'll get some kind of a supplemental plan, a drug plan, or maybe an Advantage plan. All right. And so the point is you don't have to stay on the group plan. So it could be a waste of money. Had a guy just recently I helped. His premium for him alone was $600 a month for his plan at work. And frankly, it was not a very good plan. And so Medicare was a much better value and much better insurance. Okay. And so there's times when people are working, they ought to drop the group plan and go on to Medicare as you make that comparison. All right. Now, I would tell you this. You would probably not want to drop your group plan, even if it's not the best, if your spouse is younger and also covered by the plan, or maybe children are on the plan that are covered at age 26. So we'd never want someone to drop a group plan if others are going to be adversely affected by that. But if your spouse has other insurance options, or you're not married, or children are on your plan anyways, and no one's going to be hurt by you going on Medicare, then you drop the group plan and you would then start your Medicare coverage. Okay, so if that's you and you're still working, then those would be the two different options that you have. Either take Medicare A and B because that's a better option for you, or just stay on the group plan, don't do anything with Medicare. Now, some of you may decide that you do want to enroll in A only. Now, I promise you there's no penalties if you don't take A, if the group is 20 or more. But if you decide to enroll in A only, here's the key. That A only of Medicare is going to pay second to the group. So group's going to pay first, and then the A only is going to pay a second. And A of Medicare only pays for co-insurance. They won't pay any deductibles. They don't pay any co-pays, only co-insurance. And that may happen on your plan. But keep this in mind. If you do enroll in A only at 65, if you have an HSA, then you can no longer, once you hit 65, you can no longer contribute to your HSA. You got to stop your contributions. And that's why I tell people that have HSAs, don't do anything with Medicare at 65. Just keep contributing to that HSA and still make those contributions. They're pre-tax dollars. The money can go to future medical expenses, so it's a wonderful thing. You just want to make sure that if you retire at a later date, that you stop contributing to your HSA 6 months before you apply for Medicare. Okay? All right. So that's those of you that are still working. Now let's talk about those of you that are no longer working. Okay? Meaning you or your spouse not working, we don't have a group plan available. So in that scenario, what you're either covered by some type of a retiree plan, you're covered by COBRA insurance, you could be covered by an ACA plan, or you could be retired from the military and you're covered by TRICARE. And so in these scenarios here, you must go on Medicare at 65. You have to. And the reason for that is because that retiree plan will only pay second to Medicare once you're eligible. So you have to enroll into Medicare. If you're on a COBRA plan, same thing is true. Sometimes people keep COBRA for a few months, and it's fine, but COBRA only pays second to Medicare. And so if I don't enroll into Medicare with the COBRA plan or retiree plan, and you didn't enroll to put Medicare in the first payer position, you become the first payer. And a lot of people are not aware of that. Now, when it comes to ACA plan, they're kind of unique in that ACA plans can technically be kept once you're Medicare eligible. However, all the financial advantages of that ACA plan are going to go away. There's no longer any tax subsidy. There's no longer cost sharing. So you got to pay the full premium. You got to pay all the cost sharing yourself, the co-payments, the co-insurance. The government doesn't provide any help. So that plan is no longer going to be attractive to you once you're Medicare eligible. So again, you're going to have to enroll into Medicare if you're on an ACA plan. All right. And then those of you that are TRICARE, great insurance. You served our country for 20, 25, 30 years. You retired from the military and you have TRICARE. But what happens once you're eligible for Medicare, you've got to enroll into A and B because TRICARE there was only going to pay second to Medicare. And if you don't do that, then you're going to be responsible to be the first payer. So as you can see, there's people who have to go on Medicare at 65. Now, there's another group of you, and that's those of you that you or your spouse are still working, but you're covered by a plan that has 19 or less employees at the company, 19 or less. What happens with that is Medicare says they'll pay first, and then your group plan is going to pay second. So again, if you don't enroll in A and B and you have some kind of a large claim, that group plan can say, no, you should have taken Medicare and you didn't, so they're only going to pay second. And if you didn't enroll in A and B, you become the first payer instead of Medicare. So again, these 5 groups of people have to go on Medicare at 65. Now, here's the way that's going to work. If you are on Social Security, right? You're on Social Security, you'll be automatically enrolled into Medicare. In fact, that card's going to show up about 100 days before your 65th birth month. That A and B card, you're automatically enrolled. They know you're receiving Social Security retirement benefits. They assume you don't have a group plan available, and so they'll mail you the card. And so unless you or your spouse are working in a group of 20 or more, you're going to keep that Medicare card. You're not going to send it back in and disenroll from B. You got to stay enrolled in A and B. Now, if I have to start Medicare at 65 and I'm not enrolled in Social Security, then you're going to have to actually self-enroll into Medicare. Okay, you have to self-enroll. Now, that process includes setting up what we call a myssa.gov account. And then from that point forward, we can do everything online. You'll have to enroll in A and B online, and then you'll have to decide what other insurances that you're going to want. But again, retiree plans, COBRA plans, ACA plans, a TRICARE for life, and 19 or less, then we're going to have to initiate that enrollment. Now, the key is doing this enrollment, self-enrollment, at the right time. So let me explain how this works. We have what is called the initial enrollment period, and this enrollment period is for everyone who's starting Medicare at 65. And this enrollment period, folks, only lasts 7 months. Okay, so let me explain the 7 months. Let's say we have someone that has a date of birth 1/23/1958. That means they were eligible for Medicare 1/1/2023. Those 7 months are 3 months before they turn 65 and 3 months after. And so what happens when you decide to enroll will determine when they are going to start your coverage. So if we enroll 3 months before my 65th birth month, my coverage starts on A and B 1/1/2023 in this example, right when I want it to. But if I wait for whatever reason, I enroll in January, they start me in February. If I enroll in February, they're going to start me in March. I enroll in March, they're going to start me in April. And if I enroll in April, then they're going to start me in May. And so the month that you enroll determines when they start your coverage. And if I have to start at 65, I must do it during this initial enrollment period. And if you don't, what happens is then you'll be stuck with what's called the general enrollment period. The general enrollment period is the problem with that is actually a couple of them. Number one, it's only the first quarter of the year. Okay, so I only have January to March to enroll if I miss my initial enrollment period, and when I enroll, they start me the next month. But if I find out that I made a mistake in April or July or some other time, then I have to wait till the next year to enroll. And people that come in with general enrollments oftentimes are going to be penalized as well. So we do not want to use that general enrollment period because it comes with problems as well as penalties. Okay, so that's the first issue. You want to make sure that you're coming into Medicare at the right time, not too early and not too late.
Hey, if you're looking for someone to help you hold your hand through this entire Medicare enrollment process, we would love to do that. Our team is standing by to help you. We help about 1,000 people a month go from Medicare confusion to having their plans enrolled, and it takes probably less than an hour. Go to the pinned comment below and you can book your appointment.
Now, the second mistake that people make that's very costly is going on the wrong insurance plan. Now, folks, remember, when you go on Medicare, you really only have 2 options. You're either going to stay enrolled in A and B, and you're going to get a supplemental plan, and we add a drug plan to that, or you're going to do an Advantage plan. Okay? you're going to do an Advantage plan that will also come with a prescription drug plan. And really, those are your two options that you have available to you. And so what happens is sometimes people will be lured into enrolling into Advantage plans because of all the ads. The celebrities, the movie stars, and the actors, and the famous athletes make these Advantage plans look like they're wonderful, and well, who wouldn't get them because of all the things that are going to be free? And so that can be a very costly mistake if you realize that Advantage plans will have a few items that there is no cost to. Usually, you can enroll in the plan at zero premium. They usually will allow you to see your primary care doctor for zero, and they include a gym membership at zero, and they'll include a drug plan at zero premium. So there are a few things that are truly going to be zeros. But folks, you're not going to the hospital for free on the Advantage plan. You're not going to have an MRI or a CAT scan or an outpatient surgery or an inpatient surgery for free. Those kinds of things are not going to happen. There's a cost for most services when it comes to Advantage plans. And so what happens if you enroll in an Advantage plan and you end up having some serious health issues, you're going to spend a lot of money out of pocket, because all Advantage plans, you have copays, and those copays then will go towards what's called the max out of pocket. And those range anywhere from usually about $4,000, sometimes upwards to $10,000 out of pocket. And so what happens when people have a serious health issue and they're on Advantage plan, they will spend more than what they would have had they gone with the supplemental plan. Now, supplemental plan on average, most people right now are getting G plans, and they cost about $125 a month. So what is that? About $1,500 a year in premium. And so they would have to meet a small deductible of $233 this year. So what do they spend? $1,733 for their supplemental plan and their deductible, versus somewhere between $4,000 to $10,000 if they got sick and they're on an Advantage plan. One hospital stay in the Advantage plan will cost you more money out of pocket than all year long your premiums on your supplemental plan. So the whole point is people that have health issues and will have some serious bills medically, they're going to see higher bills typically on their Advantage plan than they would on the supplemental plan. Now, if someone doesn't have any health problems and they're healthy and they know they're going to remain healthy, then the Advantage plan may make sense. But for those people that have some health issues, oftentimes they will see that they're better served on a supplemental plan than Advantage plan, just basically because the out-of-pocket expenses could be a lot less. So I just simply pay a premium and get rid of all the other responsibilities other than maybe a small deductible on the B of Medicare. And so you have to make a decision which way you're going to use your insurance, and so that's a very costly mistake if you choose the wrong one. Now, the third mistake that people can often make is by not getting a drug plan when they're first eligible for Medicare, meaning they're no longer working and they're going on Medicare and they choose not to get a drug plan. Now, drug plans are definitely optional. However, people that go without a drug plan normally do so because either, number one, they don't take any medications, or number two, the medications that they take are very low cost and it's cheaper to just pay cash than it would be to get a plan. And I understand that feeling, because you think, wow, that's just a waste of money. But you can't look at it based upon the meds you're taking right now. You got to realize people's health could change very drastically. In 3 months or 6 months, you can be diagnosed with cancer and need a medication that costs $7,000 a month. Had a gentleman the other day that had a medication that literally cost $16,000 a month. He said this medication, in his opinion, kept him alive. $16,000. If he didn't have a drug plan, he'd be doing everything possible to get that medication. But he did have a drug plan, and because of that, he's paying a fraction of the cost. So the mistake that people make is not getting a drug plan. And again, drug plans can be as low as $5 to $7 a month, upwards to maybe $50 a month. But always get some kind of a drug plan, because you have no idea what the future holds. And so you own a drug plan so you can get those drugs at a very reasonable cost through the Medicare programs. Now, the second problem with not getting a drug plan is that there will be penalties. So once we're first eligible, if I don't take one, then I can add one, but I can only add a drug plan October 15th through December 7th. Okay, so if I need a medication mid-year, I can't just pick up a drug plan now. I can only add it during this period of time, October 15th, December 7th, and that coverage will not begin until January 1 of the following year. So now I'm going to have to pay out of my pocket for those expensive medications. Plus, for every month I go without a drug plan, I'm going to have to pay a 1% penalty. and that penalty is for life. It's right now on the average about 35 cents a month. So they're going to add that to my drug plan, and so those penalties are going to add up, and they're lifetime penalties. They never go away. So that's the mistake people make without having a drug plan. You could get on medication that's costly, and now it's not going to be covered by Medicare, and then cycling these penalties are going to go on for life.